If you've recently started having sciatica symptoms that are going down the back of your leg, you're probably looking for some treatment that you can do at home right now to relieve your sciatica symptoms. There's lots of exercise on our YouTube page and all over YouTube of things you can do, but another thing that you can do that's really, really helpful is to massage the muscles that are causing the pressure on the sciatic nerve. So today we're going to talk about which muscles you should be focusing on as well as how you should be massaging them, because we want to make sure we're not putting more pressure on that sciatic nerve. First off, we're going to discuss a little bit about the anatomy so you understand what muscles specifically that we're working on. Now, acute sciatica that just started, like you bent over to plug in the vacuum cleaner and bam, you got sciatica symptoms, is usually caused by one of two things. The first one being a disc problem in your lumbar spine, and the second one being a tight piriformis. So the sciatic nerve starts from the nerve roots from L4 to S2, and there's discs in between the L4-5 and L5-S1. Those can become herniated or rupture and put pressure or mechanical irritation on that sciatic nerve. The thing is, the muscles also get really tight in response to that, which puts increased pressure on the disc, which causes increased irritation of the sciatic nerve, which increases your symptoms. So working on the muscles near there can be very helpful to help relieve your symptoms, but you do have to be careful because if it's really hot and angry, you don't want to be irritating the sciatic nerve further. Now, the second thing that can cause acute sciatica symptoms is a tight piriformis. Now, I'm going to tell you that the massage we're going to do today will help relieve a tight piriformis. However, it is critical that you get to the root of why that piriformis got tight in the first place to solve this problem for good. So basically, this technique is going to be a band-aid just to help get you out of pain, but you really need to figure out why did that piriformis get tight in the first place? Because chances are good that it didn't actually just happen overnight. It's probably a chronic pattern that's been going on for a while, and it just got tight enough to finally irritate that sciatic nerve. The techniques today are really geared towards helping to decrease your pain and improve your function, but they're not going to solve the problem in the long term. So definitely recommend checking out other videos on our YouTube page to look at what that long-term solution is. But for right now, let's get you out of pain. All right, so the first muscles that we can work on is the lumbar paraspinals. So these are these big ropey muscles, and if you're suffering with sciatica type symptoms, these muscles are gonna feel really, really tight. So in order to work on them, we wanna be kind of careful as we get into those knotty spots. And it's finding those spots of really tender areas. So really a trigger point is a hyperirritable band of tissue. And what happens when we get a trigger point is that muscle gets really, really tight in one particular area and can cause a lot of tension and pain in that area. So we want to find those spots and then kind of dig into them with your fingers. Now, if it's hard for you to reach it with your fingers, some people prefer to use knuckles, and it makes it a little bit easier to rub up and down. Now, I'm a physical therapist, so I tend to do everything over clothes, whereas massage therapists will tend to do things under clothes. If you want to do it under clothes, then I recommend you use a lotion to help it glide a little bit better. I love True Love's Deep Rub because there's no chemicals in it, and it gives you the effect of an icy hot or a biofreeze without having any of those chemicals in your body. Now, once these muscles are feeling better here, what I want you to do is go down to your iliac crest. So your iliac crest is your hip bones. So if you put your hands on your hips, you can feel those hip bones right there. Now, I want you to go just below the iliac crest. So there's a lot of fascial and muscle attachments along here. And this can feel really, really good to dig into. And you can even come all the way around to the sides of the hips and kind of help with that. So to get the sides of the hips, I like to use my thumbs a little bit more than my fingers, but you can do whatever feels good for you, and you can kind of really dig in there. There's a lot of attachments in there, and just loosening all of that up can be really, really helpful and take some of that pressure off of that sciatic nerve. Now again, you can use a knuckle here. It's hard to use multiple knuckles here because it's hard to kind of get in there because it's a bony area. But if you want to use one knuckle there, if you feel like that gets in there a little bit deeper for you, then feel free to go ahead and do that. And just go along the iliac crest, releasing those fascial attachments and those muscular attachments. And that should help to decrease that tension through that sciatic nerve, because the sciatic nerve is forming here from L4 to S2, and then it's going to be traveling down into the hip, and the next place it's going to hit is that piriformis muscle. So the piriformis runs from the sacrum over to the hip, and it's kind of a thin, strappy muscle that goes this way. So finding the area in there that's tender is important, but making sure we're not putting direct pressure on the sciatic nerve. So usually the sciatic nerve is kind of more in the middle of the muscle belly, but you'll know if you're putting pressure on it because it'll get really sharp and shooty. So avoid that area. Find another area of the piriformis that feels like it needs some work. And again, you can use fingers, you can use knuckles, you can even potentially use a racquetball to get in there and really dig on it. Now, my concern with the racquetball is that it's big, so it can be hard to avoid that sciatic nerve when you're doing it. But if you're really careful and keep it close to that sacrum, it can work for you. If you're going to use the racquetball, I recommend doing it on the wall. So you would put the racquetball on the wall, be standing there, and just do some little mini squats. The little mini squats will help to get a little massage in that area. Now, some people will recommend doing a racquetball on the floor. I don't like that as much because it throws off the pelvis. So you have this rotation happening through the pelvis, which transcends all the way up into the lumbar spine, which could put more pressure on your sciatic nerve while you're doing it. So if you're going to do a racquetball, please do it on the wall to make sure that you're able to keep that pelvic stability. The next place the sciatic nerve is going to travel is through your hamstrings. Now, massaging your hamstrings can be a little bit difficult if you're doing it on your own, but one thing you can try is getting into the meat of the hamstrings right in the center, and you kind of put your fingers like that, and then you can do some self-massage. I like to go across the muscle belly, so that's coming out. So I'm starting in the middle and coming out to get some self-massage of those hamstrings, and usually those hamstrings are super tight if that sciatic nerve is flared up. So even this can be enough of a pain relieving technique. Again, we're not trying to make any big changes in the muscle. We're just trying to get that pain down because it gets really, really irritated, and that can be really, really difficult to deal with. A couple of other ideas, if you have a roller, they used to be called the stick, but there's all kinds of brands out there now. If you have a roller, that can be a really great thing to do on those hamstrings in order to be able to get that massage. Also, if you have one of those handheld self-massagers, that can be really helpful for the hamstrings in particularly if you can have someone else do it on you. So that way you could be like laying down on your belly, just make sure that your head's properly supported so you're not getting any neck pain. And they can use that massage gun on your hamstrings, which can be very helpful to get some relief. It can be a little bit more difficult to do it on your own. Now, my caveat with the self-massage gun is I don't like to use it on the lumbar spine or along the iliac crest or even on the piriformis if you have a really hot sciatic nerve symptoms, because what happens is that can actually put pressure on the sciatic nerve, which can cause increased pain and inflammation in the area. So when it's really, really hot, I don't like to use it on the lumbar spine, the iliac crest, or the piriformis, but I'm okay doing it on the hamstrings because the sciatic nerve tends to be pretty deep there and it's harder to put pressure directly on it. Now, your sciatic nerve symptoms may be going down into your calf. They may be going down the outside or the back of your calf. You may even have some numbness and tingling into your feet. If that's you, then I recommend doing some self-massage down there as well. In order to reach your calf, though, we don't want you bending really far forward, right? Remember, the sciatic nerve is starting up in the low back, so we want to bring that foot up towards you. So we're going to do much like we did with the hamstrings in that we're going to go to the center of the muscle belly, and we're going to come out to each side just to decrease some tension, improve the proprioception, decrease the pain that's going down here. If your pain's going down the back of the calf, if it's going down the side, I like to take my hand and wrap it around and do some self-massage more with my palms. I feel like it's easier to get there. It can get kind of fingery if you're trying to use your fingers there. But hey, if that's what makes you feel better, that's absolutely fine. Some people will even run their palm down the side of their leg because that feels really good and relieving and helps them feel better. Whatever works best for you is absolutely fine. Different techniques work better for different people. Again, with the calf, if you have one of those rollers like the stick or something, that can be really helpful. And I definitely would recommend that for the calf or the hamstring. And on the calf, I'm okay with you using that self-massage gun. This one's a little bit easier to even do on your own if you're using it on the back of the calf. Now, if your pain is down the side of the calf, I don't like the self-massager as much because that sciatic nerve is closer to that surface. So that can actually make it more irritated. But in the back of the calf, it's deeper underneath that muscle belly. And so it's easier to get the massage of the muscle without aggravating the sciatic nerve. So those are the muscles that I recommend you working on if you have acute sciatica pain. So you can start at the lumbar paraspinals, go down along the iliac crest, into the piriformis, down the hamstrings, and into the calf. Really, you want to be massaging any of the muscles that feel tight. And remember, your goal is just to decrease some of the tension and particularly the pain. The goal is not necessarily to get in as deep as you can and work out all those knots. Really, you're trying to get that pain down a little bit so that you feel better. I always recommend that people ice after they do that self-massage, and that way, if you've increased any inflammation, it helps to calm things down a little bit. And if you've done self-massage all the way down, you can ice each area for 5 minutes, so it doesn't take too long, and you can get that decreased inflammation throughout your body. Now, if you're looking for some exercises to do specifically for acute sciatica symptoms, I'm going to recommend you check out this video over here. If you liked this video, click that like button, and don't forget to subscribe for more health tips.